Good afternoon, everyone. This is Vikrant from Physiorevive, and as promised, we are back with an exciting topic of how to prevent joint pain, especially in monsoon season. So, before I start, let me explain you what exactly is the process through which you get the pain. So, joint pain, if we talk about, is one of the part of the process called inflammation. Most of the times, it is there at the joint. So joint is basically a combination of two bones or two or more bones, and there are some articular surfaces, and many a times there is a process of degeneration which is going on, which is called inflammation, which could be of different types. So in one term, if I talk about, we call that term is arthritis. So arthritis is comprising of two words, which is arthro, that is basically the joint, and itis is the inflammation, that is the swelling or inflammation. So it's the swelling of the joint which we call arthritis. Now arthritis can be of different types. It can be osteoarthritis, it can be rheumatoid arthritis, it can be a septic arthritis. There are many kinds of, according to the classification. Now the most common one which majority of the people faces during their age is osteoarthritis, which is basically the degeneration of the joints or the articular cartilage. Now what are these articular cartilage? If I talk, I'll just show you this model and I'll try to explain. If this is a model of the knee joint, so here you can see a combination of two bones which makes the knee joint, and there is a small bone in front which is called patella. Now what happens, these bones, the endings are basically called articular margins, or which combines together and make a joint. Now this surface is comprising of cartilage, which is a tissue which helps to avoid getting any sort of a stress at one particular level, distributes it, it lubricates it, and the whole function of the joint, which is to move, happens smoothly. And there is a fluid also here which is called synovial fluid. So what happens in osteoarthritis, this part gets swollen off, the cartilage just weans off, just like as your car tire weans off with the time, same way your articular cartilage which is here gets wean off, and ultimately it exposes the underlying bone to each other, and every time when you move, or if you're not moving much, then also you have pain. So this is one of the most common one, especially the joint pain we are talking about. This is a little bit about the joint pain. Now pain is just one part of the process. The other symptoms can be swelling, stiffness, difficulty in moving the joint, which is called lack of range of motion of the knee joint or the particular joint. And sometimes there is a change in temperature also. So by touching, you will feel that there is a little warmth around that part. So these all are signs of inflammation. And one of the most common arthritis is osteoarthritis. The other one is rheumatoid arthritis, which is basically an autoimmune disease where your body starts fighting against your own bones and joints, right? And because of that process, there is an inflammation. So let's come back to the topic, which is how to prevent joint pains in monsoon. So in monsoon, as we are going through with this season, rain comes and there is a sudden change sometimes in the weather. So many people who are susceptible, especially those who are suffering from rheumatoid arthritis or some sort of an autoimmune diseases, they are very prone for this change in weather. So this change in weather basically is two parts of change in weather. One is change in humidity level, which affects the normal functioning of the the joints and the tissues of the body. And the second is change in atmospheric pressure, which is the barometric change. So that also affects the normal functioning of the joint. So many of the people, they face their pain has gone up, especially during the monsoon season, because there is a change in humidity level and there is a drop many a times in atmospheric pressure also because of the pre-monsoon storm, if we talk about. So this is all about why you have pain in monsoon more, especially in your joints. Now, just by following certain do's and don'ts, we can easily avoid these pains and aggravation of the symptoms. So okay, all right. Before I move, I think somebody is asking, hi sir, does exercise help arthritis? Yes, obviously one of the prime treatment of any joint related disorder will be exercise or the correct movement, I would say. So movement is the medicine in joint pains, especially whether it is osteoarthritis or rheumatoid arthritis, and it has to be customized. Now if I'll get back to the main topic, which is the tips, so here comes the tips for you all who really wants to avoid joint pains in monsoon season. Tip number 1 is stay healthy, which is basically maintaining your health well, moving well, all right, and regularly following those activities which you do normally. Many a times what happens, people stop going for a walk or stop doing their outdoor activities because of the rain many a times, and that is one of the reason why they suffer more. So first is staying healthy. Second tip is doing regular exercise, regular movement of the joint. Now what does that stands for? So the activities which involves movement of the joint. For example, if I talk about this knee, if we are bending and extending, which is the normal function of the knee, if you are doing it well, then this makes the joint lubricate, because every time when you move correctly, there is fluid which flows in the joint well, and it gives nutrition to the cartilage and other structure, and ultimately joint condition is maintained well. So doing a correct regular exercise and movement is one of the key. Then third is in terms of exercise only, if we'll talk about stretching exercise or free active exercises which doesn't involve too much of weight, will always be helpful. Full range of motion activity, we call it. So that is one of the key which will help you to prevent joint pains. Then comes the next one, maintenance of your weight. If you're maintaining your weight well, the chances are you will have less joint pains, which is again one of the prime reason. If you're not taking care of your weight, chances are there will be more loading of your joints and you will end up having more pains. Then comes the next step, which is maintaining a good healthy diet, or maintaining your diet well, because it is related again with the weight. If you have a faulty diet, the chances are you will have more weight put on a tendency, and then the chances of getting more pains. There are certain kind of food also some people are allergic to, which induces more pain. So it's very important to do your introspection and check, which will help you to understand what is good and what is not good for you. Now before I move forward, I want to answer these one or two questions. Yes, okay. So all right, somebody was asking, our exercises are good. As I mentioned earlier just now, that exercises are so essential. It is the food for the joints, you can say, but right exercise. So maybe one exercise is good for one person, may not good for the other. So that's why the role of a therapist comes. It is the job of a physiotherapist who will assign you a customized exercise program according to your need. So my suggestion to you, consult a good physiotherapist who can understand and do your assessment well, and then followed by a good exercise program, do's and don'ts, which somebody is advising you. So exercise has a definite role to play. Okay, what helps joint pain when it rains? Okay, many a times people feel nice if they are taking a sort of a warm moist pack or hot pack, or sometimes even hot shower also is going to help. So one of the tip which I wanted to mention here is, if you are going for a hot shower, that should also help, or going for a hot pack, placing on that joint for 10 to 15 minutes will definitely help. How it helps? Because it improves the circulation there, it gives warmth, and it the blood circulation to that part increases, and ultimately, the pain producing substances, they are just washing away from that part, and that way it releases your pain. It releases the muscle tension also. So hot pack is always one of the safest bet which you can always look for if you have a specific joint pain. Now, what causes joint pain in monsoon? As I explained you earlier, again I'll repeat it. There are two prime factors which are important. One is change in humidity level, which basically increases during monsoon or pre-rain or during rain. And increasing the humidity level basically alters your tissue functions basically. The second important part is change in the atmospheric pressure or the barometric pressure changes, which leads to the homeostasis disturbance, which is basically the tissue changes which happens because of the pressure changes. So these are two prime things. Then third is, there are certain category of people who have some triggering of autoimmune responses because of these two changes, and that ultimately leads to swelling in the joints or pain in the joints, which is commonly seen in people. So this is how it causes pain during the monsoon. One other important thing I want to mention here is, try to maintain a regular physical activity. Some of the people who are very sensitized to air conditioning or to change in weather or even with the fan, they may be suffering from some sort of a neuropathy or something. So first thing is, consult somebody who's expert. Second is, at least for the time being, you can cover those joints or those peripheries through a layer of a sheet or something, so that they are not directly exposed to the air conditioning or to the air. And the best would be that you should consult somebody who's an expert. So this is what you can do. And okay, what helps joint pain when it rains? I've already replied to that. I'll be looking forward for your questions. Anybody has any question? The other important thing is, if anybody is on a specific anti-rheumatoid arthritis medicine or certain things, they should not miss their dose. The other important aspect is, somebody who's diabetic, they need to regulate their sugar levels, because every diabetic patient and a normal population patient, they both behaves differently as far as the normal situation and factors are concerned. So anybody who has a diabetes, they should keep an eye, especially any change of weather. Many people they tend to have more aggravation of symptoms, and ultimately introspection in terms of what affects your problem or what affects you is very important. This is what I tell to my patients, that you have to look into what is triggering your problem. So you have to pinpoint. This is very important. The easy way to do that is, you can pen down your problems, how and what and when you have the issues. These are the important questions which you should try to answer when somebody, some expert or a physio is listening you or seeing you. At that point of time, you can explain in your history that this is what my problem is, this is how it triggers, and the chances are you may get an answer yourself by avoiding those things in future. So it's very important to have a sort of an introspective behavior, especially regarding your problems. So any other question do we have? I'm just looking. Any other question? Right. I have a question. Yeah, somebody has asked, can humidity affect joints? Yes, humidity does affect joints, because change in humidity level, change in moisture level, many people, they are prone to have change in their normal tissue functions. So the tissue, which is comprising of cartilage, muscle, your joints, your bones, right? All these structures, they are susceptible for change in humidity level and more for atmospheric pressure. So it's very important to look for these changes, especially when you are in a situation where there is a change of weather. and they do affect your normal functioning of the joint, right? Anything else? Right. Anybody? Right. Okay. What causes? I said, does a cold? Okay. Somebody has asked, does a cold compress help arthritis? So actually, no two patients are same. That is first thing which you have to understand. Second is, yes, ice packs has a role to play, especially in a condition which is recent. For example, although somebody has an arthritic issue, but on one particular occasion somebody has exerted, they stood for long, they got some problem, and because of that the symptoms have got aggravated, which are swelling, pain, difficulty in moving your joint. And if it is fresh means just recent, and the history is of 24 to 48 hours, then definitely ice pack has a role to play. But in chronic conditions where the patients are suffering and there is a background pain, subtle pain there always since last couple of weeks and months, then their hot has better function, they can relieve you better. But ice packs has definite role to play in arthritis, especially in fresh symptoms like 24 to 48 hours old symptoms. That there you can use an ice pack. But one has to look into one aspect. If somebody is diabetic, and that, or in some cases where the sensory supply means the touch sensation or the sensation of hot and cold is not normal, which is very common among diabetic patients or some patient with some neuropathy, then one has to be very, very conscious while applying ice pack or a hot pack. So this is very important to check first whether that particular area has sensation or not. If not, then one should avoid. Otherwise, yes, ice packs or cold compression do have a role to play. It will release your swelling immediately, and it will relieve your symptom, the pain and stiffness also. Because we do have a notion that as a normal population that hot is always good, which is not the case always. So yes, cold compressions are better, especially in fresh symptoms like 24 to 48 hours thing. Right. Any other question if somebody has, or we can wind it up. Right. So let me summarize again. Arthritis or the joint pains basically are a group of symptoms basically which is comprising of pain, swelling, change in range of motion, which is stiffness, and difficulty in doing movements, and sometimes even change in temperature also, which you can appreciate by touching. So these all are symptoms or the signs of inflammation. And inflammation is a process where there is some sort of degeneration which is happening. Now arthritis can be divided into usual osteoarthritis, rheumatoid arthritis, and different types of arthritis. Now how to prevent it? As I mentioned during this talk, that humidity level and change in atmospheric pressure both has a role to play in your tissue functions, especially at the joint level. So many a times if somebody has a sensitivity for change in weather, which includes change in humidity level and change in barometric pressure, then there are chances that people will have symptoms. How to prevent it? Covering the joints well, right? And doing regular exercise, regular good exercise, which is very important. Third is maintaining your weight. Fourth, maintaining your health in terms of good nutritive food. And fifth is optimal loading of your joints. What is that optimal loading? Which is just right for you. So what should be the thumb rule? Thumb rule is whatever activity you're doing, suppose you're going for a walk and you know that after doing a 20 minutes of walk you have pain, then that is your threshold. 20 minutes. So my suggestion would be that you should do your activities within your limit and gradually try to increase it. For example, in that case, I would suggest that one should go for a walk or that activity for 15 minutes instead of 20 minutes, because at 20 minutes you have issues, you have flaring up of symptoms. So this is one analogy which you can apply to different exercises. And second thing is, there are no one size fits for all kind of analogy. That means everybody is different, everybody's problem is different, so one particular exercise program may not be beneficial for everyone. It has to be customized, and this customization of process of exercise or the treatment is being done by a professional physio. So you should consult a good physio to get your customized exercise program so that you can tackle the symptoms better. Okay, somebody has asked one question, sir, is there any chance of repeated ROM exercise to increase the pain in arthritis? So the question is quite good. The answer would be the similar one which I just mentioned. Optimal is the right word. So what is the right optimal? It is like walking on a rope. If you are doing less, that is also not good. If you are doing too much, that is also not good. So what is the middle path? Middle path is you should know what is the right amount of activity is good, which is good for you. As I mentioned, this will come through introspection. For example, if you are doing an exercise for your knee joint, you are moving your knee, bending and extending, say 10 times. So by doing 10 times you have problem, but when you are doing it 8 times, it's fine. So your threshold is 10. You have to do within the threshold limit. That means you have to do symptom free. So one rule is no exercise in pain. So that analogy which people used to give, that no pain no gain, may not apply well here. One should never do exercise in pain. The exercises should relieve your pain. They should not induce your pain. So that's the answer to your question. So now the next one, how to get your okay. All right, somebody who's trying to reach, I'm gonna share my number there. Why does arthritis wear my joints down? Okay, as I mentioned, the joints are basically a combination of 2 or more bones. For your understanding, I'll just show you this piece. Here you can see the normal joint, where you can see the cartilages. These are the cartilages, basically the covering of the bones. And in this case, you can see this is the osteoarthritis, where the cartilage has weaned off. And this is the third condition, where rheumatoid arthritis, this is an autoimmune disease where the cartilage has gone, and there is an issue, the body is fighting against its own tissue. So this is just an example of how a normal joint looks like. What happens during the monsoon or during the pre-monsoon storm? There are changes in humidity level, there are changes in barometric level, and these pressure changes, these humidity level changes basically alters the function of the tissues, whether it is in the joint or over the joint, like muscle, all those structures. So the body functions got altered, and that gives you all these symptoms like pain, swelling, difficulty in movement, like that. So this is how the joint is affected, especially during the monsoon. So to tell you in nutshell, the take home message, the important part for any sort of arthritis or any sort of joint pain will be, you have to move your joint pain free. Very important. You should avoid overloading of the joint, and you should also avoid lack of movement of the joint. So initially you should work in your pain-free range. Consult a good therapist who can understand your problem better by doing a good assessment in terms of physical assessment, physiotherapeutic assessment, or radiological evidences like X-rays or MRIs. Then execution of the treatment, which is a kind of a teamwork between a patient and a therapist. So they both have a role to play. And I believe that making patient aware about their condition and getting them ready for a participation during the treatment is very important, even in the decision of the treatment options. So that will always have a better compliance in terms of the treatment and in terms of the result. So always involve your patient, consult good therapists, and with a good teamwork, any problem related to the joint can be conquered. With that, I'm gonna ask one more time if anybody has one more and any other question. Otherwise, we can just wind it off. Yeah, somebody was asking how to get connected. So I'm gonna share my number. You can Google us, physiorevive.com, and you can, if you're logging on the web, you can find the numbers and you can book the appointment. And one last thing I want to mention here is never take things lightly. It's always better to prevent instead of suffer, right? And if you're suffering, do consult somebody to make your life better, to improve quality of life. With that, my suggestion, keep moving well. Okay, somebody was asking how much physical activity should I engage in while having arthritis. All right, so my answer to you will be, it cannot be decided by me, it should be decided by yourself, right? For example, no two people are same. Suppose after walking 500 meters your problem aggravates, then my suggestion would be, instead of walking 500 meters, do less, 400 would be better. Same thing applies with your household chores. For example, you have a problem in standing in the kitchen, say for after 1 hour you have a problem. So instead of standing 1 hour, you can switch over in sitting and standing, doing 25 minutes or half an hour or 45 minutes of standing then sitting. So these are all called behavioral modification, and this will come only through introspection. That means you have to understand your problem yourself, and as much as you understand, it would be easier for the person to treat. Okay, it's hard to manage joint pain during chemo. How to conquer that? Okay, somebody who has an issue, who's going through a chemotherapy, in chemotherapy, whole of your body got affected. So your body becomes more fragile, more weaker, and sometimes even doing regular activities will be a task. So during that, you can definitely look for good physiotherapy, which will be a boon for you, and let somebody assess you, and they will definitely deliver you the treatment in terms of physiotherapy. So one should look for a good physiotherapy in chemotherapy. Yes, you can definitely get relief from the pain or discomfort as you're going through the chemotherapy. So I hope I have tried to answer most of or all of the questions. Still, if anybody has any doubt, they can connect with us through social media, through Instagram, through Twitter, through WhatsApp, and you can log on to our website, which is www.physiorevive.com, and try to do regular activity, save yourself from pain, and have a healthy life. With that, thank you so much.